Hello and welcome. And today I'm very pleased to introduce a new series, which is all about GLP-1s, which are the new drugs that you will have heard, and it's prevalent in the news for losing weight, basically suppressing your appetite. So Mounjaro, Ozempic, Wegovy. And the reason that I was sort of keen to talk about it is there's so much out there in the press and many people talking about it, but I was very keen to see if I could come up with a way in order to simplify it and demystify lots of information about it. Now, I, being of a certain age, felt that I needed to change my fitness routine. So from doing a lot of tennis and paddle and general gym and running, I felt that I really needed to get on with looking at weight training to do more. So although I've always done weight training, I felt I needed to do a bit more. So I met with a personal PT. So let me introduce Becky. Hello, Becky.
Hi.
And we started talking about how important weight training was for whether you're getting older, and also if you are actually on the GLP-1s. And then we realized that Becky, as Becky has said, so many of the people that she is training, first of all, quite shy to tell her they are actually on these drugs, but also not really sure what they should be doing. They know they should be doing something, but not quite sure. So we decided to do a short series of information covering a full range about GLP-1s. And what I would stress, we're not healthcare professionals, and everything that we say you would need to go and for your own journey is speak to a doctor. But Becky is a qualified PT trainer and also qualified in supporting people who are on GLP-1s. So Becky, please introduce yourself properly.
Thanks, Katrina. So hi, I'm Becky Lever. As Katrina has said, personal trainer. I'm freelance, but I also work at my local sports centre, helping various clients, etc. I have a number of clients that run GLP-1, so it's really interesting to share some of my experiences in working with those people, and you may get to meet some of them on the journey as we go through these series together. So yes, thank you for inviting me, Katrina.
Real. So I think, first of all, in this introduction series, what I'd quite like us to do, Becky, is just to sort of go through some of the basics of, firstly, what are GLP-1s? What's it all about?
Okay, so GLP-1s are, in terms, a receptor agonist medication that mimics the hormones in the body around eating, digestion, etc., and our need for food and sustenance. They typically slow digestion, they reduce appetite, and they help to regulate blood sugars. The GLP-1s were originally developed for the treatment of diabetes, and type 2 diabetes specifically, because type 1 is obviously insulin dependent. Those individuals don't have the ability to create insulin of their own. So type 2 diabetes is typically lifestyle orientated, weight bearing, and obviously all those other things. And so therefore these drugs were created to help in the management of weight for those individuals, to support them to try and reduce the likelihood or remove the type 2 diabetic status that they may have, that they may be at, and therefore need to and want to come away from that. So as you've mentioned, Katrina, there's some normal names that we hear out there. Ozempic, Wegovy, Mounjaro are typically the ones that we hear of. GLP-1s can be prescribed by GPs. They are privately available for individuals as well, but the BMI status is typically how individuals are prescribed them through the general practitioner, and it's usually for BMIs over 30, 35 that typically are offered these types of drugs to be able to support them with their weight management and hopefully try and reduce their weight through the process.
It is everywhere, or maybe it's particularly because we talk about it between us, but there is a lot in the news. And what is the current hype at the moment?
So there's a lot of differing opinions around them. And as I say, I am not a professional, not a qualified GP or anything like that. So I only speak from my experience and obviously working with clients, etc. But a lot of people have been prescribed them in order to help them to manage better their glucose, to manage better their weight management. And doing that, these drugs typically are able to dial back the receptors in the brain. They mimic and change hormones in the body to stop you from feeling quite so hungry, to reduce the noise around food, which is quite prevalent if you're in that situation where you want to eat. Menopausal women can go through this phase as well, where their weight blooms because their hormones are changing and everything in their body's changing, etc. at that period of time. So these GLP-1 drugs can be used in circumstances where an individual is overweight and wants to be able to obviously reduce that weight and get fitter and healthier in doing so. So the current hype around them is that they're a really positive way of doing so, but they need to be managed effectively, and the individual taking these needs support through that process, because there are things that change in terms of social engagement around food, social engagement around people. There are side effects associated with these GLP-1 drugs which can cause gastrointestinal issues like diarrhea, bloating. You can get sickness, there can be dizziness, there's all sorts of different things. Hair loss has been a big one for a couple of my clients as well. So even though they're definitely a positive and they've been helping lots of people positively, there are things that need to be considered around taking them and the impact of taking them.
Yeah, and I think that's really important, isn't it? Is to understand whether the side effect you're getting is, that's kind of okay, or whether actually that's not normal. One of the things that you mentioned, and I think it is worth, if you don't mind, just explaining to people, is food noise. Now, I thought food noise was quite an obvious, one would understand it, but when you speak to lots of people, don't know what food noise is, and it is such a huge problem if you have experienced it.
Yeah, and not everybody does, and it depends whether you're aware of it and alert to it as well. So we all have those moments where we can do unconditional eating. We just open the fridge and we might just grab something. It might be in the middle of a conversation, or it might be a certain time of night that we're used to going and grabbing a snack or something, and unconsciously we just go and we just pick something out of the cupboard to eat, or the fridge to eat. That food noise for some people is very heightened, and therefore they are unable to switch that off, in a sense that they always feel perpetually hungry, that they're always looking for food, that everything seems to revolve around the next meal, what am I having next, etc. So these GLP-1s can be quite interesting in dulling that completely. I've had a couple of clients that have said that they just really aren't interested in food anymore. They just don't have any real incentive, where they might have previously really wanted to eat cheese or crisps, or it might be that 8 o'clock bar of chocolate with a cup of tea before they start thinking about bedtime, and it just disappears. So it's a positive, but also if you're then not feeling hungry, or if you've got nausea and things like that, it can prevent you from actually eating and eating nutritiously, which then obviously is a negative, and we want to try and combat that, because we want to make sure that people are eating good, nutritious, dense food, the right amounts and levels of them, good fiber content, pre-probiotics, make sure that we're getting the proteins in, and carbs, because they're fuel and we need those to keep our energy up, etc. So the food noise can be positive in terms of dialing back, but also negative if we're losing the interest in food and we're not making good food choices.
Yes, and I know that we've agreed that we're going to do one of those social, we're going to do a chat about the social things, and obviously the social bit is when you go out for a meal and you don't want to. That can lead to lots of problems.
Exactly. If you're suffering with nausea, for instance, the last thing you probably want to do is pitch up at a really lovely restaurant and have a 3-course dinner. It just might not be something that you're interested in, because you're suffering the side effects of obviously starting on this journey. Typically, the side effects happen early because you're just starting to dose, and these are dosed by injection typically at the moment. There is moves to move to some sort of oral pill at a later point in time, but at the moment, what's been tested are the drugs that are delivered by injection. They're typically your increased dose over a period of the first few weeks. So therefore the side effects, we're trying to manage them so that they're not horrific to start with, but your body is obviously adjusting and getting used to them, because the things like, you know, the way that your digestion happens, if it's slowing your digestion down, you might feel fuller for longer. That's great, but you might also experience more bloating, where you typically your body would expend that food and, you know, move along and move to the next meal as normal. So where we're taking these now, those side effects come in, they get potentially more prevalent, and then as we dose up they can increase, or our body starts getting used to them, so therefore we get a bit more interested in food, or you know, subject to the food noise, etc. We're then able to manage those side effects more effectively, and then we dose for a period of time, and then post that the doses reduce. But with GLP-1s, the typical scenario is that they are provided to clients and to patients ongoing for life. There isn't an expectation that you take them for a period and then you come off of them. My experience in working with my clients has been very much a case of, well, here, now take your weight loss jab, and that's it. That's the last information they hear, and then they're just monitored on a periodic basis. But they have not been given huge amounts of advice in terms of how to manage those side effects and how to manage what to do when they come, and then how they should manage their dietary habits, etc., moving forwards, and their exercise habits, because that's predominantly why they've come to see me, because they know there is this risk of losing muscle mass through the dieting, because we've got fat tissues and we've obviously got lean tissue. Losing that muscle and that lean tissue, it can be detrimental to our ability for strength. It can be detrimental to, you know, metabolism and our ability to recover or prevent injuries, etc., if we get those.
Absolutely. We put down one of the things to talk about, or just to mention, was the historical context, and that was basically because the fact that you told me about where it came from, just I found it quite fascinating.
Yeah, so apparently the first GLP-1, and I've got some notes here, so apologies for looking down, but it was discovered in the Gila monster saliva in the 1990s. So this GLP-1 has been around for a long period of time. The early versions required more frequent injections for diabetes, but the new formulations are more one-weekly injections, so it's obviously reduced considerably and a more effective dose for the weight loss. The FDA, which I don't know the acronym for, which we'll find out, approved Wegovy for weight management in 2021. So from 1990 to 2021, there's obviously been a lot of work done to create a version that's safe and able to be used by humans. And then that was obviously then adopted, and physicians have been using that to prescribe to individuals with regards to the weight management support.
Thank you. So, you know, we mentioned before about support, and why it's so important. And, you know, the people that you're working with, where do they get? Well, you're saying that they're not given support from their GPs, particularly.
And it's been quite varied. So the ladies that I've worked with, because I predominantly work with female clients, the clients that I've been working with, they have been prescribed the dose through their practitioner, through their doctor's surgery. They have been given information about it, and then that's kind of been it. So for them to get support where they have been brought into the medical system and invited to obviously take these drugs to help them, they've had to go and do a lot of research themselves and Googling, you know, AI. We've got all these wonderful tools and capabilities that are out there now that we can go and use to find information, but they haven't had a cohort of individuals that they could get together with, you know, support groups, etc. But they are out there are lots of them. But as we know, and as we've said at the outset of this, not being medical practitioners, it's not right to just go and sign up to something or someone. You should ask if there are particular groups that you can join, where there are a community of people that might have, you know, gone on their journey, or still in their journey, or just starting out on their journey. And obviously finding people that have got experience so that you can leverage and understand. And different people are on different medications, so therefore they don't all work differently. The side effects can be different, so it's not a one size fits all for everyone. So do need to find different places. So there are various, obviously, medical specialists, endocrinologists, obesity medicine specialists. There's prescribing information that you can find on the NHS. The NHS website's got information that you can access. There are things like clinical trial data and peer review research that you can look for. There's, as I say, patient advocacy groups, get my words out, and support communities. And it does help to talk to people. So I know 3 or 4 of my ladies have spoken to others, spoken to each other, but I've also got 2 or 3 that have not mentioned even to their families that they've been taking the weight loss drugs. And some of the challenges with the social interaction and the fact that they've not dialed back their interest in going out socially, interest in going out for dinner, etc., has limited their ability to socialize with people. So that hasn't been such a positive experience for them. And because they don't have family that they can talk to because they've been doing this independently, they have struggled with sort of the mental load associated with it and understanding and adjusting accordingly, which has happened. They've been fine, they've got through it, and they've been, but their experience has been from the back end of it towards the end of their journey and now into more of a maintenance phase. They've said that they would like to have had more access to people to talk to, even if it wasn't family members, but people that they could just share that. Are you struggling with this, or is this normal? And those sort of typical questions that as humans, when we start something new, we want that support network to give us that reassurance.
Yeah, and funny enough, I was going to ask you, once people have started, what does it mean? And obviously, you've said one of the main ones which we've mentioned a couple of times is about the sort of social side of it. And what other things do people find?
So obviously it's making a commitment. So if you are taking them through prescription, then you've probably been fortunate of been given that by your healthcare professional. So it's a weekly drug injected. If you are having to fund it yourselves privately, obviously need to find a verified accredited practitioner to provide that. And I'm not an expert, so definitely go and ask a clinician, somebody that can give you the guidance as to where to go to and to seek that help. The side effects we've talked about a bit, obviously need to be aware that there are side effects and that they are prevalent. They tend to be worse to start with and then dial back. So that, that's something to be aware of. Dietary adjustments, because obviously if you're not going to be eating the same volumes that you have been, if you're not feeling the need for food in the same way that you have done because your receptors have been dialed back and you've got less food noise than you previously had. So now we need to start thinking about how we fuel our bodies most effectively. So things like increasing protein intake is really important. That can be from lean meats, it can be from pulses, it can be from things like Greek yogurt, eggs, etc. There's lots of different good sources of protein. Fibers, we need to make sure that we get all the vitamins and minerals in our body and help with that digestion, because obviously fiber is a significant part of our digestive tract and making that work effectively. It is likely to be long-term or indefinite use. So be prepared for the fact that this isn't 1 or 2 weeks and then we're done. This is potentially a lifelong choice that we're making. There are different reactions to different drugs, so therefore we need to find the right one that suits individuals. It's not something that one will be perfect for everybody. And then changing relationships around food, changing relationships around our social interactions with people, finding where we feel most comfortable while we're going through that journey, and if possible sharing and talking to people rather than doing this in isolation, because at least then other people are aware what's happening, and if you need further support then they can be there to do that and help you.
Yes, and also I know that in our future series we'll be talking about all of those things individually and separately as well. And I think though there is a lot to consider when you go on this and to be aware of. And I think and you hear quite often the difference in your relationship from being one size and then changing to another size, and how that affects you physically and mentally with your partner.
There's quite a significant undertaking when you've got to go and buy a new wardrobe financially. You're losing weight. It's a side effect. It's a nice one to have, hopefully, but then also when we're looking at it, and I said earlier on with regards to the fact that the tissue loss that that we're losing weight as fat, and we're also losing weight as lean muscle. So in doing so, my primary advocate is obviously getting people through the gym and through my sessions where they're focusing on resistance training and making sure that we try to increase the protein and we try to increase the resistance training, so that we're trying to protect as much of that muscle tissue as possible as we go through this journey. And if we can, build more lean muscle tissue so that we're reducing the fat content in the body.
Absolutely. And so that's our first session drawing to an end, I think. And if I was professional, I would know and have up what we've got for our second session. Can you remember?
Well, I think we were going to think about talking around body reactions. So some of those impacts to the side effects that we've talked briefly about today. We would be talking about what we feel when we're going through the process, what the patterns are, and what the body composition changes are as we go through taking the GLP-1s on that journey, how we might feel in terms of energy, and then things like variations and body adaptations. That they were our second session.
Well, hopefully you'll join us for our second one and you'll find out exactly what we're going to talk about in the second one. So Becky, thank you so much for our initial chat, and I hope you join us on our next one. Thank you.
Thanks, everyone.
Bye.